If you are over the age of 35, stop everything you're doing right now. After a lifetime of eating fatty foods, you may run the risks of a stroke or heart attack due to plaque buildup in your veins and arteries. To learn how you can reduce your risks, visit youthfountainlab.com or call 1-800-853-7856 today. This may be a life-changing call for you or someone you love. Thank you, and we hope to hear from you.
Yes, family, welcome back to the African Diaspora News channel. My name is Richard Sudan. Thank you very much for tuning in. Now, a UK story today to bring you some information on. We're learning, and by the time this video airs, there'll probably be more details, which I'll keep you up to date about. But we've learned that a man, we think a black man, has died following contact with North London police. What we do know is that the police were called to a scene in North London, and by the police's statement themselves, they've acknowledged that the person was having a mental health crisis, the person was unwell, and the statement has also acknowledged that the police restrained this individual, and the details are sketchy, but we know that this individual died following police restraints and police custody. Now again, I should sort of hasten to add, we don't know all the details yet, but we do know this was a mental health crisis. We believe the individual to be a black man, and we know that the police did restrain and handcuff a potentially very mentally ill, unwell man. Now, I can tell you something about the history here in the UK regarding black people with mental health issues and the way the police treat them. There are umpteen examples over the years that we could talk about which show you how black people have died following police restraints. I use that word ambiguously because that's the phraseology the police and the government use, following police restraints, when actually what black people needed was serious medical care, and this is often acknowledged by the police and the authorities themselves. Now, we know from evidence from numerous studies that the police quite simply treat black people and non-white people completely differently to white people, particularly when black people are in the midst of a mental health crisis. Evidence shows us, unfortunately, that a lot of the time black people are viewed as some sort of threat to white police officers, regardless of what they're doing, whether they're armed, unarmed, whether they pose a threat or not, it doesn't matter. And even if people are extremely vulnerable and are in the midst of a mental health crisis, we know that rather than getting the care that they need, they are just treated brutally and with violence by the very authorities that are supposed to look after them, and by which these individuals often would have paid their tax. Black communities pay tax for a police service and yet often get treated as if they are not human. There are very famous cases which go back a few years now, but there are cases of individuals like Mikey Powell here in the UK, cases like Leon Patterson of black men who were having mental health episodes and who needed care, but were just treated as some sort of superhuman violent threat by the police, were restrained, brutalized, and then died following those conditions. But we also had a recent case here in the UK just a couple of months back, earlier on this year. We had the case of Moed Bashir, and I actually covered that story. I covered that story in depth on a number of platforms. I'll just tell you the story of Moed Bashir, which is a heartbreaking one. Moed Bashir was a black man who was having a serious mental health situation. Moed Bashir had actually suffered a knife wound some weeks before or some days before his contact with the police. So his leg was already injured, and Moed had been suffering mentally because he was concerned about the injury. He was concerned the injury was not healing, and it was also a stab wound, and he had a number of things going on in his mind which were causing him serious distress. Now imagine this. Moyd's family one day decided to ring the GP to get medical advice, because they were concerned that Moyd's leg injury was not healing as it should do. Now imagine in this instance, the police were not even called. This is key. Remember I said this. The police were not even called. There was a doctor that was called. Now, regardless of this, the police actually turned up to Moyd Bashir's address. They basically traumatized Moyd's family. They entered the house and they restrained Moyd Bashir. Now, the police should have known, would have known, did know that Moyd was a very vulnerable young man who needed serious physical medical care and needed serious mental, psychological, physical care. But regardless of these circumstances, we know that black people are just always viewed by a threat by many in the police. And so the police actually ended up restraining Moyd Bashir to the floor, somebody in need of care. They basically reopened Moyd's leg wound, which was already seriously wounded. The wound began to bleed again, and Moyd actually died as a result from his injuries following his deadly contact with the police. And we see this situation play out time and time again. There are umpteen cases I could sit here, numerous cases I could bring you about the contact that black mentally ill people have with the police and how deadly that is. I remember covering a couple of cases in the US this year, a few cases. One of the cases which stays in my mind is the case of Daniel Prude, which I think was in New York. Daniel Prude, again, was a black man, seriously vulnerable. His brother actually called the police in order to inform them that Daniel Prude was unwell. He was out in the streets in New York. The police actually restrained Daniel Prude to the floor, put pressure on his back and his neck, left him shirtless in the street without proper clothing as it was snowing. I believe that Daniel Prude was actually crying out for his life, explaining to the police he couldn't breathe. The police, of course, didn't view him as human in the first place. That's why they treated him as they treated him, and Daniel Prude died as a result. And one of the things which always sticks in my mind when I see these cases all too often is that, if you're black and non-white and your family member is having a mental health crisis, do not call the police for help. Do not call the police for help, because there's a big chance, or there's a chance, that will be a death sentence for your family member. I've actually written about this before in the Independent newspaper here in the UK a couple of years back. And my argument was there needs to be a separate service that people can call and people can dial when they're having mental health problems. Because it's abundantly clear, and this is not my opinion, this is backed up by numerous studies, numerous heart-wrenching stories from many families that they can give you, that the police are simply not fit to deal with mental health crises. They're not fit to deal with these crises on a number of levels. So there needs to be a completely different service for people, particularly for black people, when their loved ones are ill, they're sick, and they're dealing with mental health episodes. There needs to be an entirely different service that can be accessed. There need to be trained specialists that are able to come on site to look at the situation, to determine exactly what's needed, exactly what the medical condition is, and then determine what's needed. Because these people need hospitals, these people need medical care, they need to be treated as human beings and with sensitivity in the same way, let's keep it real. When, white people are having mental health crises, or they can even be behaving, wielding knives, wielding whatever weapons, and they don't end up dead. I remember seeing a video in the US of someone clearly not in their right mind, literally wielding a knife at officers, hanging off the car door of the police while the police car is driving around. And lo and behold, this person was able to be safely handcuffed and taken to where ever they were taken. But this is not the case with black people. You know, it wasn't the case for Daniel Prude. It wasn't the case for Moy Bashir in Wales here in the United Kingdom. And we need some sort of different service we can access in serious medical emergency conditions. But yeah, just wanted to bring you that story. We've heard of another death in custody following what the police have acknowledged is a mental health crisis. I'll bring you more details as they emerge. But yeah, black people, don't call 999, don't call the police if your family member's having a mental health crisis. You know, get the medical help they need, but you know, getting the police onto the scene, it's just not the one for us. It's just not the one. But yeah, thank you for tuning in. Let me know what you think about this topic in the comments. Much appreciation for you tuning in as ever. Remember to hook up to the African Diaspora News website. Spread the word. Thank you for tuning in once again. My name is Richard Sudan, and we will see you next time.
I'm Don with the Law Office of Don R. Dennis Jr. My office helps businesses that are involved in complex business deals. The issue is this: when you sign an agreement, are there adequate protections to help you in the event things don't go as planned? And do you comprehensively understand all the terms in the agreement? As an engineer, experienced attorney, and certified privacy professional, I've seen all types of agreements. My office's motto is engage diligence, because I believe clients have the right to a responsive attorney that has the same energy for them from the beginning until the end. If you're looking for an attorney that's going to fight for you and not with you on your matter, contact my office at 213-455-0880.
Thank you for watching, and make sure you subscribe to our YouTube channel and check out the African Diaspora News Channel app in the Google Play and Apple App Store.